Here we are reducing pandemic risk, right? Not by, looking into gain of function research, but by eating bugs. There you go, Canada. I want you to get mad. I want you to say, no, I'm not eating bugs to reduce pandemics. For public health, embedded with the WHO, passed by our Trudeau and Singh government, No coup in our country, no to Bill 293.
Many of you are probably already familiar with the World Health Organization's attempts to strengthen its mandate and increase global surveillance and control through things like amendments to the existing international health regulations and a new pandemic treaty, accord, agreement, whatever they end up calling the thing. But right here at home, the Canadian federal government is passing an act, legislation, that will grant broad powers to the Minister of Health to deliver a top-down approach to anything health-related that is arbitrarily deemed a potential health risk or threat. Bill C-293 is called the Pandemic Prevention and Preparedness Act, and it passed its third reading on June 5th earlier this year. It will head to the Senate next week to receive royal assent, but not if lawyer Lisa Myron has anything to do with it. She notes that despite Trudeau's attempts to stack the Senate recently, she's sounding the alarm on this act and not only its lack of definitions and the potential for a police state, but verbiage around censorship, the control over communications and information. Joining me now to discuss this legislation and its potentially sweeping impact on things like agriculture, food supply chains, and the environment is Myron, who has 24 years of legal practice under her belt and a Bachelor of Science in Environmental Science with a minor in chemistry. Check it out.
So this is a One Health approach. That's the selling feature of a One Health approach is it sounds like, everywhere around the world we're going to have the same health approach. But what it really grants is power within this bill in a One Health approach, and they put it in the preamble and they put it in the body that this bill must deal with humans, animals, plants, ecosystem health, and welfare interface. So your welfare interface is your relationship with your government. So it's a grant of power over all of these things. And the reason why this grant of power is even worse is that it is instructive on the basis of could lead to a pandemic. Pandemic's not defined. Could lead to the risk of a pandemic. That risk doesn't have to be a material risk. That risk is not defined. So this gets invoked all the time. And then what we see also is that there's a sustained collaboration that has to happen with all levels of government, all levels of even the Indigenous government. And so it's infiltrated on the basis of the idea that, hey, there could be a risk of a pandemic, therefore we have to control this. What else do we have to control? We get to control your information, right? We get to control your information structure. There's all kinds of grabs of power that would normally be either in the federal or the provincial realm that aren't. And that also it purports to have a power outside of Canada, and that it says it's going to deal with all activities. So all activities is not defined, of Canadians. So everything that you do at home and abroad. So, hey, that's even a global reach.
So who is going to conduct these activities? The Act itself will amend the Department of Health Act to appoint a National Pandemic Prevention and Preparedness Coordinator from the Public Health Agency of Canada, which will delegate to the coordinator the powers, duties, and functions that the minister considers appropriate, which Morin says likely means directives come from external global health authorities, since the Public Health Agency of Canada had to establish a satellite office of the WHO called the National IHR, that's International Health Regulation Focal Point, as required under Article 4 of the IHR.
And over the 20 years or 19 years between 2005 and present, there's a real opportunity for the WHO to be inserting itself into our public health officials. If information is going back and forth and public health is a satellite office, are we putting in essentially a treaty without a treaty. We've domesticated this legislation. We're creating power that an NGO through the WHO has domestically in our country. And, 3 readings of the House. It's passed 3 readings of the House. So it's an all hands on deck moment for Canadians.
Myron says that one of the biggest concerns, aside from sweeping powers and data sharing, is that the Act lacks clear definition of what constitutes a pandemic, what constitutes as a pandemic risk, including its scale and materiality. She also highlighted that the One Health approach implies extensive control over various aspects of life, affecting the relationship between individuals and the government, and jurisdictional challenges around all of it.
There's monstrous provisions in here that have passed our House that are quite frightening. And so I'm going to I'll tell you one here, 2C. Ensure the sustained collaboration. So sustained collaboration means all the time. So here we have a department that's being created. It's being headed by public health. We have a concern that that's actually the WHO. We have a sustained collaboration between the Ministry of Health and provincial governments. So they get to, this is an all the time working with our provincial governments and Indigenous communities. They get to infiltrate inside to the Indigenous communities, the development of the plan in order to align the approaches and address jurisdictional challenges. Okay, so what could be the jurisdictional challenges here that they want to, eliminate through collaboration? Well, the first jurisdictional challenge is that health is, should be something that the province is doing. And here they have it at public health, possibly the WHO. And so that's a jurisdictional challenge. What's another jurisdiction? You could say that if they're infringing the rights of Canadians, and there's many ways that they can do that in this all One Health approach, that you would have the court's jurisdiction to push back. But if we're going to smooth out that's a jurisdictional issue. And then your personal sovereignty, right? That jurisdiction and the idea of, hey, maybe this is an NGO treaty that is bypassing treaty mechanisms. And so is that a jurisdictional issue? And so, there's all kinds of legal problems with this bill that haven't been, flushed out or even discussed.
When the panel said, listen, give it to 6-month-old babies with zero assurances this possibly would be safe. I said, where were you the day when the WHO came out and said, do not use remdesivir in the hospital? I'm Dr. Peter McCullough. Join me for an evening together. Tickets are on sale now.
Of course, there are stipulations in the Act around collection and sharing of data through the establishment and interlinking of surveillance systems. This Act also ropes in the Minister of Industry, Agriculture and Agri-Food and the Minister of the Environment to include measures to increase public health capacity around the world and to ensure equitable access to vaccines, testing, equipment, and treatment.
So interlinking surveillance systems, we are already surveilled without asking and pushing back on the questions of what's going on with our privacy. The Trudeau government and its NDP friends have put through bills that watch us online, and we're erecting a smart city infrastructure that has the ability with biometrics to watch us in the real world. So this interlinking surveillance system power that they give to themselves can go in really awful directions. And that will include to manage the availability and management of relevant stockpiles. So what are relevant stockpiles? They say including testing equipment and personal protective equipment, but including means not limited to. So what's a stockpile, right? Is this a command economy that they're giving themselves? Are they getting access to everything that the Ministry of Industry or anybody else might have as a production effort in Canada? So, and when they say the availability, that means they can withdraw that availability. It doesn't, people always think the positive. Well, they're going to provide us with relevant stockpiles. Well, no, they just get to control that availability and they get to manage that availability. of stockpiles. Stockpiles, there's no definition section. It's not defined. So why are they getting access to all of our goods within that? And they get to, in that same section, talk about the give themselves the award to communicate the risk to the public. So that's in I sub V. So when they get to communicate the risk to the public, that's a censorship provision. That's how I read that. It means no one else gets to do the communication of risk. So that means a small group of people who are anointed, those are the only people with brains. Those are the only people who have logic at their disposal. And those are the only people who own the science. So they communicate the risk, and that means if you have a different opinion on that risk, you won't be able to communicate it. That's a way to shut down outfits that are pushing back like Rebel News. That owning of the communication of risk is not something that we as Canadians should be putting up with. And that doesn't bode well, because I don't believe that they looked at one thing that might be relevant at reducing a pandemic, which is, one, eliminate conflicts of interest so that pandemics aren't profitable. Two, shut down selling pathogens from our labs, level 1, 2, 3, and 4. 3, eliminate funding gain of function research. 4, eliminate diplomatic immunity. 5, eliminate the immunity from prosecution in contracts for these preventative measures that aren't effective at preventing. So, anything relevant that I would say is relevant to preventing a pandemic is not here. So that's also problematic.
Another concerning element of the bill is the section stating that it will promote commercial activities that can help reduce pandemic risk, including the production of alternative proteins.
Bingo. So you eating bugs or Gates meat printed in some lab, right, or Soylent Green, wherever they go with this possibility, and I'm facetious there, but in some ways, sometimes I'm not. The grant of power is so totalitarian. Here we are reducing pandemic risk, right? Not by looking into gain of function research, but by eating bugs. There you go, Canada. I want you to get mad. I want you to say, no, I'm not eating bugs to reduce pandemics. For public health, embedded with the WHO, passed by our Trudeau and Singh government, our Singh government.
Myron leaves with a message for Canadians.
Anyone who proposed this bill and passes it is proposing a coup on Canada, and they should be judged. And so I'm judging every MP right now, and every Canadian has to judge every MP. We need an omnibus bill that reverses every single piece of legislation or proposed legislation, including that Bill 63, that horrid is not, again, another not defined. What is hate? It's hate. Hate is disagreeing with your government, it's going to be. So we need to get back to Western values, and Canadians are being bombarded with financial issues, homelessness, economy, high interest rates, they've been dialed a little bit, climate change, schools. We have to focus on one thing, and that is, this is a coup. We want our country back, and the only way to do it is to reverse all the bills Trudeau's brought in. And when we do so, we're going to do so for every other country around the world, because all these countries are facing the same kind of globalist infiltration. So that's the second way. I do know there's a few people starting to organize on September 11th to go for their legislatures, parliament, their courthouses in small towns. No coup in our country. It's a 911 September 11 SOS. No coup in our country. No to Bill 293.
An SOS call to action has also been launched with a one-click politics link, where Canadians can send a form email to senators calling on them to vote no to Bill C-293. For Rebel News, I'm Tamara Ugolini. At Rebel News, we've been keeping an eye on the WHO and its inner workings at exposethewho.com. At that website, you can support our work and sign up so that you never miss an update. That's exposethewho.com.